Someone hit cancel. All right, we're live. Jenna, you can play my video. What's up? AP Psych, Cram, Crammy, Crammer, Crammiest. I need a better word for that. So I'm gonna stop acting a fool. My name is Amanda Duermerol. I am the founder and CEO of Fiveable. I've been helping AP students feel confident for their tests for like 10 years now, which is honestly like just pretty wild for me. But I've been doing Fiveable for 5 years, our 5th birthday, and I just love this stuff. I love being able to bring students in from around the world. And, you know, like you're all going through the same thing together. There's no reason to be stressed out right now by yourself because all these other students, these are your support. This is your community. We've got you. They've got you. We're going to do this together. So super stoked for AP Psych tonight. This Cram preview is going to cover bipolar mood disorders, which is an important topic in AP Psych. So Cram previews kind of give you a sense of what the finales feel like. What does it feel like to be in this live setting with these incredible hosts, these student hosts who have taken AP Psych, who were in your shoes not that long ago. They're really good at helping you to understand the content. So if you do not yet have a Cram pass, you're going to want to grab one. So you can get that link below. And Psych, I mean, y'all, I hate to like totally stress you out, but your test is a week from tomorrow. So, my bad. So put in the chat 1 through 5. How are you feeling about that? Are you feeling like a 5? Honestly, give me the test right now. I'd be fine. Or are you feeling like a 1? Like I got a lot of work to do before I'm ready. No matter where you're at, these finales are really going to help you out. So we're going to be live Thursday, Friday, Saturday, Sunday, and Monday, 5 nights straight, 3 hours each night. That's 15 hours of review, covering literally everything, every unit, multiple choice, FRQs, the whole thing. So by the time you wake up on Tuesday, you're going to be like, I got this. I'm like a 6, 1 through 5. No problem. AP Psych, like, I got this. I know I can do this. That's how we want you to feel. So, like I said, grab that Cram pass if you don't already have it. You'll be happy you did. Think about your future self. So, with that, I'm gonna hand it over to the awesome AP Psych team and let you guys cram away. Talk to you soon. Bye. What's up, AP?
All right, Rakesh, you want to hop in for our AP Psych Cram preview? We're gonna take over after that video.
Can you hear me?
Yeah.
I'm sorry. It's just like the tech is just not it right now. So should I just start? Okay. Well, welcome everyone. Thank you all for coming to our AP Psych Crams preview number 2. So this is okay. Wait, let me go to the. Jenna, could you like reshare the screen for me? Like the screen's like all black, so I can't see what slide you're on.
Yeah, I absolutely can. Give me just a second. Sorry about that. Can you guys see it now?
I still cannot see it. That is so weird.
Can anybody else on our team see it?
Yeah, I can see it.
Oh my god, it's just a me thing. Okay. Does someone else want to take over the intro bit then? Because I can't.
Yeah, absolutely. Sorry about that. So we here at Think Fiveable on our socials, you can follow us on any of the major social media platforms at Think Fiveable. And we are going to be your night 2 preview right now of our bipolar mood disorders. And then anybody else from our team that wants to jump in, absolutely feel free to. And we're going to kind of cover what's going on right now. Can anybody else see my screen now?
Yeah, of course. I can do a quick little introduction. So, hi everyone. My name is Christina, she, her, and I am one of your student hosts for tonight.
Okay. Hi, everyone. I'm Rakesh. Sorry for the poor intro before, but I'm also one of your Cram hosts for tonight.
Hi, my name is Selena, and I also go by she, her, and I am also one of your student hosts tonight, and I'm so excited to be here.
And then my name is Jenna. I am your teacher host for all of the upcoming Cram sessions that we're going to be having. And I am so sorry for all of the screen sharing issues because I'm too millennial for Crowdcast. So I'm gonna learn and we're gonna get way better at it.
So I'm not up on the slide, but my name is Sean. I'm also one of your Cram hosts. I'm excited to be here with you all.
Okay, so today our agenda is we're going to go over mood disorders, basically the definition and some common causes, and then we're going to dive deeper into bipolar and related disorders, and then we'll end with a practice quiz and a Q&A. So as AP students, I ask you guys to please remember to treat this topic with respect, as it's a sensitive topic, especially considering it is part of the clinical psychology unit. So we're going to start with mood disorders.
All right. So Sean and I are going to be teaching us about mood disorders. Sean, where are you at?
Hello, hello.
Hi. All right. So when we look at mood disorders, really what we are evaluating with a mood disorder is anything that has to impact like mood from a scale from like the lowest of mood possible, being like that massive, severe depression, and then ranging all the way up to like this very elated severity of mania. So all of our mood disorders, they can also be called affective disorders, and that's just about our affect. So the way that we are experiencing our emotions. So with our mood disorders, I think one of the common things that's like a little bit of a misnomer is that a lot of the times people think that our anxiety disorders are actually mood disorders, when in reality, anxiety disorders are not mood disorders. But we're gonna learn really well about that.
Yeah, and when we're gearing up to get ready for this AP exam, a couple big ideas we want to take away from the psychopathology or clinical psychology and mood disorder unit are how can we distinguish between the different categories of psychopathological disorders? So tonight we're going to talk about the distinction between major depression and bipolar disorders.
Yeah, we will. All right, here we go.
So yeah, sorry.
No, go ahead, take it away.
Yeah, so in psychology, one of the most central questions that we ask throughout all the units is the nurture versus nature debate. And so when we're getting into what kind of causes different mood disorders, we see a wide variety of different potential causes that span both nature and nurture, both genetic factors and environmental factors. So
I'm
one
going
of
to
the
throw out the question real fast to the chat. Is it, and I'm going to ask the most basic question, is it all, as like a large statement, and might be a trick question, but is it nature or is it nurture? Tell me your answer in the chat. because I think I know you guys are going to catch me on this one. So tell me what you think. As we wait for that to roll in, when we look at that whole, good job, everybody that is rolling in over there. Amazing. Thank you. Perfect. We know that psychological disorders are caused by, no way it's nature, are caused by a combination of factors. So those factors, some of which are on the slides, as you can see, but those factors predominantly are things like genetics. So that whole nature aspect. What else do we have, Sean? So in addition to like nature and genetics, what else do we got?
Yeah, there's also stuff like major life events that's more the nurture. Different trauma-inducing events, different ways of being brought up sometimes, different conditions that we're placed in. And when we talk about what causes these different mood disorders, it's not, as you guys can clearly all see from the chat, it's not which one or the other caused it. It's usually a combination of both.
Absolutely. So we know that there's some traits that are more caused by things like nature, and then some traits that are more caused by nurture. But one of the things with mood disorders and affective disorders, we know that there's some differences in brain function between individuals that do and don't have mood disorders. So especially within our neurotransmitter systems. So I know I might say it on the board, on your computer, but if you know it, tell me the neurotransmitters that we know to be really critically important for mood disorders. So there's a few that we know. Pop those in the chat. And these are actually the neurotransmitters that most medications for mood disorders, particularly those depressive disorders, actually act on. So other than things like neurotransmitters and neurotrophic factors that are in the brain, awesome job, everybody that is in the chat. I see that. I love it. Great job. There's some things like learning and development that also influence mood disorders as well. And it really is dependent upon like which component you are looking at these disorders from. And we're going to talk day one of Cram finales. We are going to talk all about the different perspectives of psychologists and the different approaches that we can use to actually investigate all of these different things, including our psychological disorders. All right. Anything more to say on this one? I know we kind of breezed over some of them. No? All good? Okay. All right. Let me get back to that. There we go. And we're going to hand this one off now to Rakesh and to Selena to take over.
Okay, so basically what we're going to focus on concerning mood disorders is that there are two types of mood disorders. One is depressive disorders and the other one is bipolar and related disorders, as you might or may already know. So as we kind of went over a little, depressive disorders are the persistence and presence of a sad, empty, or irritable mood, and this affects how an individual functions in their daily life. And for bipolar and related disorders, these disorders are characterized by extreme mood swings between manic and hypomanic episodes and depressive episodes, sorry. So there are two types of bipolar disorder. One is bipolar I, and then the other one is bipolar II. And then when we go to the related types of disorders, we have psychosomatic disorder. So bipolar I is the most severe due to the presence of manic episodes, and we'll get more into the difference between bipolar I disorder and bipolar II disorders later. And if you can see in the bottom there, so basically the key difference is the presence of mania, which is a period of extremely elevated mood and high energy levels. And this can lead to really impulsive and reckless behavior, and it can become dangerous to that individual or to others. So getting more into bipolar and related disorders. So the key difference between bipolar I and bipolar II disorders is the severity of symptoms. When we're talking about bipolar I disorder, there's only manic episodes followed by hypomanic episodes. And then in bipolar II disorder, there's only hypomanic episodes. So manic episodes are more severe than hypomanic episodes, and a manic episode can cause impairment in a social or occupational functioning sort of sense, and it may necessitate hospitalization to prevent harm to others or self-harm, and there may be psychotic features, which include hallucinations and delusions. So the symptoms of these different mood states is when someone is having a depressive episode, there is diminished interest or pleasure in nearly all activities. There's a lot of insomnia or hypersomnia, fatigue and loss of energy, and then feelings of worthlessness or excessive guilt. I'm not going to go over all of them, so I'm just going to move on to some symptoms from manic episodes and hypomanic episodes. So there's a lot of being overly talkative and wildly energetic, or having a really inflated sort of self-esteem. There's a lot of decreased need for sleep, and there's excessive involvement in high-risk activities. And as we talked about, since manic episodes is the more severe of the two, hypomanic episodes are much milder and last for a shorter amount of time. So we don't really know what bipolar disorders are caused by, but we do believe that it is caused by a mix of biological and environmental factors, which is basically kind of like genetics, and if it runs in the family, and even twins are actually seen to have bipolar disorder more commonly than in people who are not twins, and environmental factors, which includes traumatic events or major life changes.
Okay, so now we're going to get into treatment of bipolar disorders. So treatment includes psychopharmacological medications. And whenever we think of treatments, you have to know that we're not treating the disorder, we're treating its symptoms, and we're managing the symptoms long-term treatment. So usually for bipolar, we use mood stabilizers like lithium, antipsychotic medications, and antidepressants. The main thing that you need to remember is lithium, because that is the one that is most commonly asked. They ask for lithium because that one's a mood stabilizer only for manic episodes. So make sure you remember that one. And the other side, we also have psychotherapy, which includes cognitive behavioral therapy and psychoeducation. But it's also good to note that combining these two is most effective for treating these episodes and managing the long-term treatment. So another bipolar disorder is cyclothymic disorder, and that is characterized by emotional highs and lows rather than manic and depressive states. While it is not as severe as bipolar, it is longer lasting than both bipolar 1 and 2. And some of the symptoms include like mood swings, irritability, and periodic highs and lows. And treatments include cognitive behavioral therapy, psychotherapy, and family therapy as well. Okay, so just to cap it off, just make sure you remember lithium. Mood stabilizers like lithium are used to treat manic states, used to treat schizophrenia as well, but it's mainly for bipolar disorder. So whenever you see lithium on the test, just think of bipolar. Make sure you know the similarities, like bipolar disorders involve swings in moods between hypomanic or manic episodes and depressive episodes. And know the differences. These are small differences, but they're really big on the exam. Know the disorder specific symptoms, because these are more likely to appear than symptoms that are common between multiple disorders. And finally, treatments, just know that no single treatment works for all disorders. Some individuals benefit from the combination of numerous treatments, and like the symptoms, focus on disorder specific treatments because they focus on specificity, and try to remember at least 2 for each disorder.
Cool. So thank you so much, Rakesh and Selena, for giving a really in-depth overview. And just before we begin our review session, we just wanted to ask you guys if you had any preliminary questions or any other AP tips on this section that you wanted to know. So feel free to drop it in the chat or through the question link, and we can take a few minutes to just answer any questions you guys might have had on this previous section.
In the meantime, so I know Sean just dropped that question in the chat about cognitive behavioral therapy. So, what are our thoughts on, well, not our personal thoughts, but when we look at the different forms of therapy that are readily available, what makes a therapy best for one psychological disorder? It's something like bipolar mood disorder or depressive mood disorder, or something like anxiety versus obsessive compulsive disorder. What makes one therapy type most effective for treating, a certain subset of disorders rather than others? It was like an actual question, but I let's let's talk back and forth. So we know. I guess I can come back on camera while we go through this, because I'm not seeing a bunch of questions yet in the comments, which we absolutely should be putting some in there if you guys have some. So when we look at different forms of therapy, things like CBT, or like a really investigative type of like a form of kind of like psychodynamic theory that's looking at, past traumas and, learned experiences and development. What are the things that make some more effective? Or to put it the other way, is there a form of therapy that's more effective for some disorders but not others? Is that just not the case? What have we learned?
Yeah, kind of building on Jenna's question, what kind of therapies would be better for schizophrenia versus depression? What would work better or worse for each one, and why?
So we just got a really good question in the chat about what's the difference between CBT and psychotherapy. And realistically, the psychotherapy is just a form of talk therapy. And there's different ways that can actually take hold. So things like CBT are cognitive behavioral therapies, which we'll learn a little bit more about. And there's actually a quiz question on our CBT. Wonderful. Look at that comment section filling up. CBT is like looking at maladaptive cognitions and ways that we kind of process information, and then combining that with ways to improve behavior. So behavioral strategies that are actually going to physically rewire our brain to respond differently to situations. Okay, now that chat is really filling in. Those are awesome. Yeah, and I see some things about behavioral therapy for addictions, exposure therapy, or even things like systematic desensitization are super effective for phobias as well. I really liked seeing all that. Cool.
Now, Jenna, I have a question for you as well. So what if we were wondering, if one kind of therapy isn't working for a specific condition, is there a way to try a different one? Do different therapies work the same for specific conditions, or are there different therapies that are better for some conditions than others?
That's a really, really interesting question. So first, I'll start off by saying that I am not a diagnostician or a clinician. So this is not my area of expertise whatsoever. For those that are here that missed the last Cram preview, I am a PhD student in experimental psychology, but this is not like my exact research focus. So I might be missing some information and maybe not have the most comprehensive answer to this question. However, when certain forms of therapies aren't working, rather than just assuming that the psychological disorder is untreatable, or that the cure, or not that there's a cure anyways, but symptoms will never subside, really switching to different forms of talk therapy especially can be really, really effective. So some people don't vibe with certain types of therapies, for example. There's things like EMDR that some people really, really love and other people really don't like. And that's meant to get at those unconscious associations that we build outside of our awareness. But then there's things again like cognitive behavioral therapy, or even my personal like research preference is systematic desensitization over exposure therapy. But some patients prefer exposure therapy to systematic desensitization. So just because it's not working immediately doesn't necessarily mean that it's untreatable.
Yeah, thank you for that, Jenna. And I guess students, another question for everyone in the chat. What could possibly be some barriers to receiving these different kinds of therapies? I'd be curious what you guys think some of the barriers might be.
This is also another one of the quiz questions that I had put out. So I love that we're touching on this, and then we can kind of get an idea of what those quiz questions might look like. Little tips and tricks in advance.
Yeah, and I love all the answers flowing in right now. Finances, stigma, those are all awesome answers. Financial status, accessibility. There are definitely some, like I know psychotherapy is very, very expensive, which is why not a lot of people tend to partake in it. I know stigma is a huge barrier to people getting therapy, and our cultural norms, like what our culture and society says about people who have psychopathological disorders. So yeah, these are some awesome answers I'm seeing in the chat. And these will be great things on sometimes your FRQs. They'll ask you about limitations to different questions. So if they ask you about a limitation of some kind of therapy, these are all great things to keep in mind.
So I totally forgot that our back channel chat is like telling me to read these questions that are on the board that I've been completely ignoring. I'm so sorry. So the difference between exposure therapy and systematic desensitization. I am so sorry to my entire team that's like, hey, look at this. So systematic desensitization, I don't know if maybe we don't learn about it in AP Psych, but I teach intro to psych at the college level, and I really like talking about this difference because when we look at exposure therapy, when we have somebody who is experiencing significant fear in their life of strong enough to make them phobic of it, this intense anxiety, this fear that's surrounding the stimulus, when we use exposure therapy, we do kind of like those small baby steps of slowly getting, accustomed to even thinking about that stimulus, that thing that makes us afraid. But a lot of the times what we see with exposure therapy from a research perspective is that it actually can lead to increased anxiety, especially when it moves too fast. So imagine you're just like completely, utterly terrified of, I don't know, I'm not going to throw out a fear just in case somebody is afraid of it because I don't want to like traumatize our chat right now. But you're afraid of something, right? And you're using this form of therapy and they're telling you consistently to think about it, to approach it. That's exposure therapy. On the other hand, when we use systematic desensitization, we actually use principles from classical conditioning. So I know we learn about that in AP Psych. And just as a little bit of a reminder, classical conditioning is a form of emotional learning responses where when we experience one stimulus, a emotional or physiological response will happen in return. So with systematic desensitization, what we actually do is teach patients a kind of like calming or soothing technique, something that's going to bring their heart rate down, something that's going to physically counteract the effects of the anxiety from the phobia. So emotions are really interesting in that we cannot simultaneously experience two opposite emotions. So we cannot simultaneously be experiencing intense, deep-rooted fear at the same time as we're experiencing calmness and relaxation. So what we do with systematic desensitization is we teach calming techniques, and then we pair them with the phobic stimulus at a really, really low level. So the great thing about, at least in my opinion, systematic desensitization is that rather than just exposing people and being like, okay, well, you're going to get used to it and get over it eventually, what we do is actually pair it with something that's incompatible that emotional response is incompatible. So I really like, for that reason, using, systematic desensitization over exposure therapy. Hope that answered that question. Okay, so are we ready to pop into that review quiz then? Because I need to just move over my screen. Does that work for everybody? Awesome.
Also, a quick question. Is this the first time we're using like the 5-able quiz?
Yeah, I think so. I don't know if it's the first time we're using the 5-able quiz, but I don't know if it's the first time 5-able's using the 5-able quiz.
Like, I
Yeah.
was just thinking, because that'd be really cool, because, AP Psych gets the first peek into these quizzes.
I think so. I
It's
don't
the
know if we're
first.
the first Cram session to host it, but
Yes.
yeah, we definitely
Yep.
are one of the
Amanda
few.
just revealed that, yeah, we are the first night with the quiz.
Nice. Okay. We don't have enough participants joined. So basically, for our viewers, what you're going to do is type in this this link right here into ideally your phone, or big massive QR code. You can use that QR code that's right there. I think it'll be easiest to do on your phone rather than your desktop, so you don't have to, dual window or anything, which is exactly what I continue to have problems with tonight. So pop it into your phone if you can, and if you can't, of course, you can use your device. And then once we have a good number, I'm going to start this quiz and we can run through those practice questions. Just wait for people to kind of filter in. Okay, team, what are we thinking? Should we give everybody a few more minutes? Christina, why don't you just let me know when you're ready to jump in that, and then I'll hit start for you.
Sounds good. I think we are ready to start now, and you guys can feel free to join as we go. And if you can't access this quiz somehow, please just make sure to drop your answers in the chat, and that's totally fine as well. Cool. Okay, so headed on to the first question. Please let us know if you can't see the screen somehow. But the first question is, what is etiology? Is it A, cause of psychological disorder, B, the research behind disorders, C, result of psychological disorder, or D, the categorization of disorders? And yeah, we'll give you a few minutes to answer this. And again, you can feel free to drop your answers in the chat right here if the website doesn't work for you.
We are almost there. Are we ready to reveal, Christina?
Yeah, I think we're about ready. Thanks so much, everyone, for answering. So let's reveal the answer. So yeah, there seems to be a lot of mixed answers here, but the correct answer is A, cause of psychological disorder. So I guess just to give like a brief explanation, etiology basically refers to the study of the causes or origins of psychological disorders. So basically, etiology can involve just a lot of examining a different range of factors, and this includes like biological, genetic, environmental, social, and also cultural influences that may contribute to the development and maintenance of various mental health conditions. So this is super important because by understanding the etiology of a particular disorder, psychologists can develop better treatments and interventions that basically address the underlying causes of the condition rather than just like treating the symptoms itself. So just a quick question or a quick like follow-up answer. You can find this concept in Unit 8, like of clinical psychology. And again, like just a brief overview of the unit. The unit itself focuses a lot on the study of abnormal behavior and mental disorders. So that's why like etiology is such an important concept to nail down. So yeah, that's basically the whole concept, and hopefully you're able to gain like a better understanding of the underlying factors that contribute to the development of these conditions after you nail down this concept. So yeah, great job everyone. And yeah, so now we're moving on to the next question. So a period of impaired functioning, sometimes present for no apparent reason, lasting for 2 weeks or more, is known as blank. A, post-traumatic stress disorder. B, major depressive disorder. C, obsessive compulsive disorder. Or D, panic disorder. So I'll give you guys a few minutes to answer.
Awesome job, as people are pretty much done with that one. So let's look at our answer here. Are you ready, Christina? Let's do it.
Yay! That is so much better. Great job, guys. It is B, major depressive disorder. You guys are doing awesome. Oh my gosh. So yeah, I guess just to give a little explanation of what major depressive disorder is, it's basically a period of impaired functioning. And obviously this lasts for around like 2 weeks or more. And it's one of the major criteria for diagnosing MDD, which is also known as major depressive disorder. And MDD is basically a type of mood disorder that's characterized by a lot of persistent feelings of like hopelessness and loss of interest and sadness in like various activities that they used to like enjoy. So basically some other like diagnostic criteria include like symptoms such as like changes in your sleep or appetite, or just feeling fatigue, or like feelings of worthlessness or guilt, or just difficulty concentrating and recurrent thoughts of death or similar concepts like that. So yeah, and I guess this is just a really important concept to know, as well as like all the other answers as well. And I would just remember for the AP exam to understand like the symptoms and how they distinguish from each other. So be sure to understand the differences between MDD, OCD, PTSD, and panic disorder. And yeah, great job, guys. So. And yeah, so this is the third question. You guys are doing great. So I'm just going to read it. So April, an aspiring novelist, will often spend weeks writing feverishly, getting little sleep, and these periods of high energy and creativity will then often be followed by weeks where she can hardly get out of bed, as she is convinced she will never be published. A psychologist would most likely diagnose April with A, panic disorder, B, bipolar disorder, C, mania, or D, OCD. So I'll give you a few minutes to answer.
While you guys are answering that, I wanted to show you, I showed everybody that is on our Fiveable team earlier, but while you're answering that, you can take a look at my amazing mug that I brought with me with my tea today. It says Freudian Sips, who is my favorite crazy psychologist. And then the back says, when you say, I can't even see, when you say one thing, but you mean your mother. We love Freud here, as wild as that psychologist is. He had some crazy ideas, but he was funny, for sure funny. Who is like, as you guys are going through this, as you're answering your questions, okay, you know what? I'm going to save this question for the next one because it looks like we're all done. Are you ready for me to reveal the answer, Christina? Yeah.
Wow, you guys are really on top of it. Yeah, the correct answer is B, bipolar disorder. So I guess just to give you guys an explanation of what bipolar disorder is, it's basically, again, like one of the types of mood disorders, and it's characterized by just periods of depressive and manic episodes. And just to clarify the difference between those, manic episodes on the one hand are just periods of like abnormally elevated or irritable mood, and there's also a lot of like increased energy and like a loss of like the need for sleep, and a lot of like grandiosity and just a lot of racing thoughts and poor judgment. So that is what manic episodes are. But on the other hand, depressive episodes, in contrast, they're characterized by the same symptoms as those in major depressive disorder, as we just talked about before. So as you guys can see, the scenario described in the question of April, the aspiring novelist, it really fits the pattern of bipolar disorder, because April experiences a lot of like periods of high energy and creativity, which are indicative of a manic episode. But these manic episodes are then followed by periods of low energy and difficulty functioning, which are characteristic of a depressive episode. So as you guys can see, the other answer options are just incorrect, and I'll just give like a brief overview of this. But panic disorder is wrong because it's a type of anxiety disorder with like a lot of recurrent panic attacks. Mania is wrong because it's a symptom of bipolar disorder, not a separate disorder. And then OCD is wrong because it's an anxiety disorder that's characterized by a lot of obsessions and compulsions or repetitive behaviors. So yeah, great job, guys. We will move on to the next question now. Okay, so question 4 is, during the manic phase of bipolar disorder, individuals are most likely to experience A, high self-esteem, B, extreme despair and sadness, C, delusions of persecution, or D, visual hallucinations.
Okay, so I'm bringing it back around to the question I was going to ask as you guys fill in this question. So I know everybody's up in the chat saying Freud is crazy though. Why do you have his mug? Because he's crazy. It's funny. I love it. It's funny to me. I love Freud, not his ideas. I just love how crazy he is. So I asked, what is your favorite wild psychology theory? So anything that we've talked about in AP Psych that is just absolutely bonkers and you're like, that's crazy. It could be something that blows your mind because of how fascinating and cool it is, or it could be something that is just confusing and wild. So throw it in the chat as we are about to answer the next question.
No, one of those things that always got me in AP Psych was when the experiment with the lines, the compliance to others, or not, compliance to others, where participants saw 3 different lines and were asked to see like which one matched the original line, and like a good chunk of them got it wrong just because all the Confederates in the study answered it wrong as well. And that was one thing I could never understand. I don't think I'd ever pick the wrong line if I was put in that situation, but apparently it's possible.
It is. Okay, so first off, I have to address that everybody in this chat is talking about Freudian ideas, and that is why I love Freud so much. These ideas of the Oedipus complex and penis envy. And if we have ever met Karen Horney, whose ideas literally just go against everything Freud said, I just love the energy so much. But yes, Sean, the conformity study with the lines, that is, have you seen the videos for that? There is an actual recording of those participants or during the entire study. And there's one participant and he has this kind of like shorter hair. And this is, I know him because his face is so funny during the entire thing because he gets so flustered. And you can see him in this line study about conformity. I hope everybody knows the conformity study that I'm talking about. He's like, but the answer is C. It's C. And everybody else is like, no, it's D. And then he conforms. And I love psychology for that reason.
I actually vividly remember watching that video in my intro psych class. He was just looking around like what's going on?
Yeah. Oh my gosh. Thanks so much for adding on to that. And I guess just to go on to this next question here. Yes, the correct answer is A, high self-esteem. So I guess just to give you a brief explanation of this, during the manic phase of bipolar disorder, a lot of individuals may experience symptoms such as like a lot of increased energy, decreased need of sleep, racing thoughts, impulsivity, and high self-esteem. So in turn, they may like feel a lot more confident or just like have a really high sense of euphoria. But this can also lead to a lot of poor decision making and risky behaviors like substance abuse or just like excessive spending, if you're familiar with that. And just to recap, the other answer choices are incorrect because extreme despair and sadness, they're symptoms of the depressive phase of bipolar disorder, not the manic phase. And then delusions of persecution are incorrect because they're symptoms of like paranoid schizophrenia, but not like bipolar disorder. And then visual hallucinations are also incorrect because they are present in some mental health disorders such as schizophrenia or substance-induced psychosis, but they're not really a typical symptom of bipolar disorder. So yeah, you guys are doing a great job. And now we're going to move on to the next question. So this is the next question. Which is not a key idea of treatment for psychological disorders? A, correcting damaging thought patterns. B, teaching healthy responses and coping mechanisms. C, analyzing causes of the disorder with psychoanalysis. Or D, conditioning appropriate emotional responses.
While you guys answer that, I actually saw an awesome question in the Q&A page. Aren't there visual hallucinations in mania too? And when we're in the AP exam thinking about answering the questions, it's super, super important to know what kind of psychopathological disorder they're talking about and to look at the answer choices and see which one kind of applies to that specific condition. So when we're talking about depressive disorders, the visual hallucinations are almost never going to be the answer because those are like hallmark of psychotic disorders. So when you're attacking the different questions on the quiz, try to keep that in mind. What category of disorders am I talking about, and what's typical to that category? And if I know visual hallucinations are more common with psychotic disorders, it's probably not going to be the answer to the bipolar disorder question or to the depressive disorders questions.
So yeah, and I guess with that being said, we can hop on to reveal the correct answer. And yeah, so there is a mix of answers, but the correct answer is C, which is analyzing causes of the disorder with psychoanalysis. So yeah, I guess just to give another brief explanation, analyzing the causes of a disorder with psychoanalysis, it's not a key idea of treatment for psychological disorders in modern psychology, actually, because psychoanalysis is actually a type of therapy developed by Freud himself, and it was based on the idea that a lot of unconscious conflicts and repressed emotions are the root causes of mental health disorders. So a lot of modern psychologists have developed like different forms of therapy that focus on like evidence-based treatments that address like the symptoms of the disorder. And all the other options are actually all key ideas of treatment for psychological disorders, because for example, like correcting damaging thought patterns is a key idea of CBT, or cognitive behavioral therapy, which is a really widely formed use of therapy to identify like negative thought patterns. And then obviously like teaching healthy responses and coping mechanisms is also used in CBT and DBT, which is dialectical behavioral theory. And then lastly, conditioning appropriate emotional responses is a key idea of exposure therapy, which we discussed a bit earlier. So yeah, you guys are doing a great job, and we'll go on to the next question now. So the next question is antipsychotic medications blank blank activity. A, increase dopamine, B, decrease serotonin, C, decrease dopamine, and D, increase serotonin.
I absolutely love these more bio-heavy questions. It is just my favorite form of psychology. I am a biological psychologist at heart, and so seeing these just warms my little PhD heart.
I'd also like to add that like manic and depressive episodes are like
Rakesh,
And-
you are cutting out. Is it just me, or is Rakesh cutting out for other people? Yeah, no, Rakesh. Okay, try again.
Cool. And with that being said, we can reveal the correct answer since most of you guys have responded already. So yeah. And yeah, that's the correct answer, guys. Great job. The correct answer is C, which is decreased dopamine. So just according to antipsychotic medications, they're just a type of medication that's used to treat psychotic disorders such as schizophrenia. So a lot of these medications, they work really well by just blocking the activity of dopamine in the brain. And dopamine, again, just as a refresher, is one of the neurotransmitters that's involved in a lot of like functions like movement, reward, motivation. And it's a lot seen in like individuals with psychotic disorders. So basically, when dopamine is believed to be overactive, this can contribute to a lot of symptoms of antipsychotic medications like hallucinations, delusions, and other symptoms. And so if you block like the dopamine activity, a lot of these antipsychotic medications can help to reduce these symptoms. And as a little brief explanation, the other answers are incorrect because a lot of them are just not primary effects of antipsychotic medications. So yeah, you guys are doing a great job, and we'll move on to the next question now. So the seventh question is, the success of any type of treatment is affected by A, all of the above, B, environment, C, mental illness stigmas, or D, socioeconomic status. And yeah, since I believe many of you have already answered, or most of you have already answered, we can reveal the correct answer, which is yes, A, all of the above. So this is pretty self-explanatory, but all of these factors like the environment, mental illness stigmas, and socioeconomic status, or SES, all influence the success of any type of mental health treatment that you go to. So yeah, we can move on to the next question now. So this is the next question. Cognitive behavioral therapy adds blank onto cognitive therapy. A, behavioral evaluations, B, progress logs, C, prescribed behaviors, or D, adaptive behavior. And yeah, so since most of you guys have already answered, we can go on to reveal the correct answer, which is, there is some mixed answers, but the correct answer is D, adaptive behaviors. So basically, adaptive behaviors, they're a really desirable outcome of CBT. And the goal of CBT is basically to help individuals develop these adaptive behaviors through a combination of various behavioral and cognitive techniques. So yeah, great job, guys. And we'll move on to the second to last question now. So yeah, the next question is, what is the most common reason for people not to seek mental health help? A, treatment would be ineffective. B, confidentiality concerns. C, wasn't covered by health insurance. Or D, couldn't afford cost. Cool. And since many of you guys have already answered, I know we're going a bit fast, but that's because of time. But yeah, the correct answer is couldn't afford costs. So as you guys may or may not know, a lot of people do not seek out mental health help because a lot of the costs for mental health services are actually extremely expensive and not covered by insurance, or they might live in a mental health desert where they just don't have access to it. So yeah, that's a pressing issue today, actually, in psychology. So yeah, now we'll move on to the very last question of our quiz. And that is, when considering the causes of a disorder, the blank approach hardly ever accounts for emotional responses. A, humanistic, B, psychodynamic, C, sociocultural, or D, cognitive. And yeah, I guess we can reveal the correct answer now, if that is all right. But there is some mixed answers. But yeah, the correct answer is the cognitive approach. And I guess just to, like, as a tip for the AP exam, you just want to recognize and be able to understand all the differences between the humanistic approach, psychodynamic, sociocultural, and cognitive. And just remember that, once again, the cognitive approach doesn't ever rarely accounts for emotional responses. So yeah, that is the end of our quiz. But thank you so much, guys. You guys did an amazing job, and you guys are going to do great on the AP exam. And just as a quick little outro, if you guys haven't gotten your Cram pass already, be sure to get it by clicking that green link at the bottom of your screen. And yeah, I'll leave it to the other student hosts as well to give a little outro.
Yeah, if you want to see all of our faces again, we would love if you could get a Cram pass and stick with us for 5 nights. We promise we'll get you ready for that AP exam.
Did we need to head back over to like the main slides for anything, or are we good to finish up and wrap it up right here? I think Does that work? We can finish here. Perfect. All right. Well, thank you guys for spending your Monday night with us. And like everybody said, we've got 5 nights coming up of extensive content review. So join us then, and we will see you soon. Thank you.